everyone, Aubrey Tager here with Neurologics Integrative Health. And the reason why I made this video is because I want to talk to you today about how we do things differently here at Neurologics with regards to mild traumatic brain injuries, also known as concussions. Our approach is a lot different than some other places. Now, we have to keep in mind is that 80% of all concussions are going to resolve themselves within probably about 6 to 8 weeks. It's when they don't that we start to see issues with what's called post-concussion syndrome. And that's where things are going to get different and why certain people are not going to recover the same way as others. Now, what are those mediating factors and why does that happen? And that's what we want to address here right now. So our approach is taking what's called a neurometabolic approach. Now, what does that mean? First of all, what we have to do is we have to define what metabolic or metabolism is. And what metabolism is it's the physical and chemical process that happens when a living cell or an organism that are necessary for the maintenance of life. So this is basically how a substance is broken down to yield energy for all vital processes. Now, every single neuroanatomical pathway in the body has a metabolic component to it. These pathways can be impacted by things like hormones, neurotransmitters, opioids, or even things like cytokines, which are basic proteins, and prostaglandins. And these are the mediators of blood flow and inflammation. Now, other factors are also going to be extremely important, such as blood glucose levels, so blood sugar levels, and oxygen transportation, which directly impact the cell's ability to produce ATP and energy in order to support the neuron endurance. So the actual cell's ability to be able to endure any kind of activity whatsoever. Now, metabolic factors should always be considered when evaluating the brain and developing any kind of brain rehabilitation program if you want to have the maximum effectiveness and maximum outcome. Now, certain problems are going to affect that, and this is what we call comorbidities. So things like diabetes, poor circulation, inflammation, methylation defects. And if you want to learn more about methylation, I do have some other videos on my YouTube site and on my website, neurologics.ca, which talk about methylation and how that can impact the body as well. Other things like essential fatty acid deficiencies, anemias, endocrine disorders, and autoimmunity are all factors that are going to influence recovery from any kind of traumatic brain injury. Now, the importance of things like diet, nutrition, and supplementation, as well as your medication that you're taking, are all necessary in the concussion rehabilitation process. Now, one of the things that are extremely important on the other side of it, we talked about the metabolic side. Metabolic factors are vital and have a huge impact on recovery, but they can induce what's called plastic change. So this is the basis for what we call neuroplasticity or brain rehabilitation, which includes the making of new neuron connections and also aiding in what we call mitochondria. That's the powerhouse of the cell, the mitochondrial production. Now, activation of these damaged neurons that occur during any kind of traumatic brain injury can only occur via stimulation. So we actually have to stimulate those neurons. So how do we do that? Well, we come up with a brain-based therapy program. And what that's going to do is it's going to be a combination of individualized therapy, such as things like vestibular therapy, eye exercises, which include things like saccades or anti-saccades, maybe something like a parietal pursuit, or even things like cold laser, exercises with oxygen, spin therapy, some state-of-the-art technologies such as things like Neuro or eye lights, or maybe optokinetics. These are just some of the therapies that we may include when we customize a program to tailor the need of an individual following a traumatic brain injury. So for a really, really customized approach and to be able to take care of your post-concussion syndrome, for those of you who are not getting better, we are the ones to come to at Neurologics Integrative Health. So give us a call at 514-426-6449 or visit the website at Neurologics, that's Neurologix.ca. Thanks for watching, and we'll see you soon. Bye-bye.